This is your Medicare Monday newsletter. I found a couple interesting articles about Medicare Advantage plans and their kind of deceptive advertisements, and how hopefully the Biden administration as well as CMS are going to try and figure out ways to combat this. But that takes time, and also, how do you know what ads are deceptive? Well, what a lot of the ads are saying is that you can get more benefits than you would on A and B. That's true, but from a certain point of view, you get more benefits like dental, which is not included in parts A and B of Medicare. You get gym memberships, which aren't added. You get prescription drug coverage. Typically, if you pick a Medicare Advantage plan, it's included in the plan, and you don't get that with A and B. You got to buy a separate Part D plan. But what they don't tell you is that when you are joining, or when you become a member of one of these plans, you are now allowing this plan, the Medicare Advantage plan, to, I guess, control how you receive the benefits that Medicare would have offered you. I'll give you a good example. This example that I use all the time, sorry if you heard it before. If you are someone who has to get some kind of image scan, be it a ultrasound, CT scan, X-ray, MRI, right? Those are very different scans for different things, but sometimes they can be used interchangeably depending on, what the doctor is looking for. Now, if the doctor says, hey, I think we need an MRI for this. An MRI can be as much as, a few $1,000s. But maybe there's enough evidence in the medical journals to say, hey, maybe we can go with a CT scan, which is a couple $100s. Or better yet, maybe we can just do an ultrasound or an X-ray, which are borderline about $100 or so. If you are on a Medicare Advantage plan, most likely, unless there is significant data that says that you should not get anything other than the MRI, you'll most likely be subject to, number one, a prior authorization, which could delay your care. And number two, probably you'll be told to do the lower costing item to save money for the members on the plan. If your doctor wanted to fight for the MRI, they would have to schedule an hour, maybe, to talk one-on-one with someone from the insurance company, which is called a peer review, to get your benefits covered. And many doctors, if you know anything about doctors, while they really want to do it, there's no time. The doctor barely has enough time to see you for 15 to 20 minutes. Do you think they have enough time for an hour set aside on their day to do something like that, even when they won't get any reimbursement? There's no compensation for a physician to do a peer-to-peer with the insurance company. It's 100% cuts into their schedule. Many of these doctors have to do it on their lunch break or after work or during their admin time, which usually they would have to do to get back to you. If we have that those messaging system where you can ask your doctor a question on a My Chart or whatever electronic medical record system that the hospital system has. So it's a really big issue. And more as you get things happen to you and you need care faster, Medicare Advantage actually puts a dampener on getting your care quicker, which they don't talk about. Now, the ads that they're talking about are not gonna, of course, address these things that I'm talking about, but it's something to consider when you're looking to enroll in any of these plans that they offer or that they talk about on TV. All of them that they talk about on TV are most likely Medicare Advantage plans. Medicare Supplement plans, which is the plans that I rather have my clients enroll in, they're boring. All the plan letters are all the same. The coverage is always all the same. If you get a plan G from company ABC, it's the exact same as the plan G from company XYZ, as same from, company 2 or company X or company A, all the same. They're standardized federally across the nation. So if a company were to advertise their plan G, then what's to stop that person from looking at plan G and finding a different company, right? So many of these companies do not even attempt to market for Medicare supplement plans. So it's up to people like me who want better benefits when it comes to medical benefits and a better medical experience for people who are on Medicare. And that's kind of all I really wanted to say with this short Medicare video. If you guys have any questions about open enrollment, because open enrollment is actually coming up, and for all my clients who are on Medicare Supplement and Medicare Part D, this has nothing to do with you, other than if you were looking to shop around your plan rate, maybe it's a better choice to wait until March or April, if you can. Now, if you're feeling like you want to do it soon because you feel just like you want to, because anything can happen in a day even, or in an hour. So if you wanted to get underwritten for a new plan for a new rate, let me know as soon as you want. But right now, during the open enrollment period, people who are on Medicare Advantage and watch a video like this and understand that maybe we should get onto a Medicare supplement plan because we don't want to have any barriers to our care when we need it the most, they have this opportunity to cancel their Medicare Part C plan and attempt to enroll in a Medicare supplement plan. So during the annual election period, they have that chance, and also during what's called the Medicare open enrollment period, which takes place between January 1 and March 31st. So the Medicare supplement companies will be busier underwriting all these people who are trying to get out of the Medicare Advantage system. But again, now is not the best time, so it might take longer to get underwritten. But if you are concerned about the plan you're on, or your current health, and you want to get, from a plan G to a plan N because the savings is better, or you're on a plan F now and you're like, man, I should really get onto a plan N because it's so much cheaper and the financial benefits are really kind of similar, and I'm paying $100 a month more for something that I really don't think I need, then maybe now's a good time to change just due to those things. But again, it is up to you. Hope you guys make good decisions. If you need more information about certain aspects of Medicare, please let me know in the comments below, or send me an email if you're one of my clients, and I'd be more than happy to help. With that said, you guys have a good rest of the week, and we'll see you next week for the next Medicare Monday.